ผู้อำนวยการองค์การอนามัยโลกมาเยือนประเทศไทยค่ะและได้พบและก็หารือกับพลเอกประยุทธ์จันทร์โอชานายกรัฐมนตรีนะคะนอกจากกล่าวชื่นชมเรื่องนโยบายหลักประกันสุขภาพทั่วหน้าของไทยแล้วที่เป็นต้นแบบให้ประเทศอื่นได้เรียนรู้ยังพูดถึงความเป็นไปได้ที่ไทยจะเป็นศูนย์กลางผู้สูงอายุในอาเซียนค่ะคุณณฐา กมลวทินสัมภาษณ์พิเศษกับผู้อำนวยการองค์การอนามัยโลกค่ะ
If a government has that realization that no one should be left behind and whatever based on the resources we have that we should support our communities equally, then they will invest in health. And healthy people also bring prosperity, so they will not see it as a waste also. They will think that it's good for development.
There is the proposal that perhaps Thailand can be center of aging society in ASEAN. What do you see the prospect of this and what WHO can help Thailand advocate on this?
It's the right direction that WHO agrees with the Prime Minister, and we would be happy to help on this, and we want other countries to take that position. You know, the elderly population, it's the way you treat it. It could be silver tsunami, some people say, meaning trouble, if you don't have the direction that Thailand is following. That's, you don't consider it as a productive force and you don't consider it as part of the national development. It could be silver dividend if you consider it part of the national plan and if you give it the employment opportunities and believe that, it can contribute to national development.
With the disruption of technology, we see how the world is moving into innovation, AI, robots. Of course, in medical area is also included with new technology, genome or stem cell. How would you see this new technology of new innovation can integrate with UHC? Will it increase in equity, equality for all, or will it even enhance more gaps between the rich and the poor?
I see it as opportunity. But one thing we should do is we should see that, we should believe that, accept that it's coming, and we should prepare for it. For instance, we should really imagine what's going to be the future of health. Where will we be in 30 years from now? Where will we be in 50 years from now? Where would the current, be it artificial intelligence or whatever, evolve in 30 to 50 years? And how do we really try to use those as opportunity that brings equity, affordability, and the rest? If we prepare for it, we can make use of it to realize UHC. Technology brings equity, it can bring equity. Technology can bring affordability. Technology can bring quality.
Also, one clear purpose of visiting Thailand, you attend Prince Mahidol Conference Award in 2018, and one of the mission is to fight the threat of infectious disease. How do you see this threat is coming on, and what should be the world revolutionize or prepare infrastructure?
You know, the threat is there. We're still vulnerable. You know, in 2014, Ebola affected some countries in West Africa, but the whole world was in panic and fear, as you know. And the root cause of the problem is there is systemic problem in terms of, our health systems in many countries are not strong. Prevention, in terms of strength in preventing disease is not really strong, or early detection, or when we detect, response. What you see is there is a weak system in many countries, and we're as strong as the weakest link. So there is vulnerability. That's what we have to admit. And we have to really build the capacity. And the central point should be, number one, building the capacity of countries. But if there is outbreak, to detect early and respond. So there is national capacity that should be strengthened. So the weaknesses we have could be addressed. And the second is, no country is safe unless all of us are safe. So those who are better off should support the weaker system to be strong.
Director General, your work is very tough. You have to respond to crisis very responsibly. How do you take care of your health on a daily basis?
I'm not sure if I'm well disciplined, but I try to do physical activity.
It's even tough for you.
And I'm glad Thailand is a very strong advocate of physical activity. So I think keeping active and avoiding the risk factors, including, all the things we say, including physical activity and so on, will be very important. So I try to stay active and move and at least do the minimum 10,000. I cannot guarantee you that I always have the 10,000, but I will.
10,000 steps?
Yes, I will try to be more disciplined on that.
Director General, thank you very much for joining me.
Thank you.
ขอบคุณค่ะ
ขอบคุณค่ะ
Thank you.
Thank you.